Hi, I'm Kaylee and I'm a peer supporter for families and babies. Today I'm going to show you how to position and attach your baby. This will prevent you from getting sore nipples and it will give you a good milk supply for the future weeks or months, however long you're going to be breastfeeding for. Okay, so first what you need to do is make sure that you're sitting nice and comfortably because you could be sat here up to an hour. Okay, so make sure you've got some cushions supporting your back to keep your back nice and straight. Okay, if you want to use cushions around just to support baby, that's fine too. Let's get them to hand. Make sure you've got a drink and maybe a snack next to you as well, and anything else that you might need for the next 30 minutes up to an hour. Okay. So, when you're holding your baby, try and hold baby with the opposite arm to the breast you're going to be feeding your baby on. This is called the cross cradle position. Okay. So bring your baby's tummy nice and closely into yourself. You can use this arm to tuck baby's legs around you here. Use the crook of your arm there just to support the baby's bottom and use your arm there to support the baby's back. Okay. Keep baby tucked in nice and closely just so that your baby feels nice and secure when your baby's coming in for the feed. Thumb and forefinger in a C shape. Okay. And hold the back of baby's neck. Try not to hold the back of baby's head, okay? What can happen here is you'll end up pushing the baby's chin down. And if you try and swallow with your chin down, you will struggle. So try and put the thumb and forefinger around the back of baby's neck. This will help the head to fall back and the chin to be free to touch the breast. So tummy tucked in nice and closely to you. It to the side for you. So nose to nipple, never take yourself down to baby, otherwise you'll end up with bad backache because you'll end up in this position. So it's nose to nipple, wait for your baby to open his mouth nice and big and wide. Okay, you're waiting for a yawn kind of position. Nose to nipple and wait. You might want to just brush the nipple with baby's top lip. When you see baby open mouth nice and big and wide, which is for a split second, really quickly. Get your baby on there as quick as you can. Okay. That's going to mean that you're not going to get sore nipples and it's going to, like I said, cause a good milk transfer to come through. The nipple needs to be, if you run your tongue across the roof of your mouth, so that soft palate, that's where the nipple needs to be. So if you bear that in mind, that's why we have to be so quick when we bring the baby to the breast. So there's things that you need to look out for so that you know that your baby's attached to the breast correctly. Nice big full round cheeks. If the cheeks are going in at the side, then just take your baby off the breast. Okay, the way to do that is to get your little finger in through the mouth and just to hook that nipple out of the baby's mouth, okay? And then you need to go through the position attachments again to get the baby on correctly, okay? Most of the areola in baby's mouth, it's fine to have a little bit of the top showing or all of the areola, depending on the size of your areola. Sometimes you can see the baby's cheek moving or the ear moving. The kind of movement you're looking for is fast, rapid sucks, and then eventually go into deeper sucks, so suck and pause and rest, suck and pause and rest. It should, after 20 seconds, be pain-free breastfeeding, okay, and then you know that you've got your baby attached on the breast correctly. If you try and take deep breaths, deep breathing for the first few seconds, that's going to help with the attachment if it is hurting you. That'll get you through the first 10 to 20 seconds, but after that it should be pain-free, okay. Once you're happy with your position attachments, you can then bring your other arm across your baby and get yourself into more of a comfortable position, okay. Try and remember, keep baby tucked in nice and close throughout that entire feed. What can happen is your arms can relax with breastfeeding and baby can slip down onto the end of the nipple, okay, and chew on you at that stage as well. So if you can keep your baby tucked in nice and close, it's just going to enable you to carry on having a pleasant breastfeeding experience. Okay, so then get yourself nice and comfortable and enjoy feeding your baby and obviously giving your baby all the benefits that breastfeeding can bring.